Hi, folks, and welcome to another episode of Health Talk from Marz. It's out of this world. In a recent podcast, I did a review of Dr. Walter Longo's book, The Longevity Diet. And in this book, he discusses a fasting mimicking diet, which is a program that he developed and a product that he developed specifically geared towards fasting, making it easier than a normal fast. So stay tuned for my review of this product. Okay, in today's episode, we're going to cover a product that was developed by Dr. Walter Longo. Dr. Longo is a physician who specifically studied under the mentorship of a Dr. Roy Walford. Dr. Roy Walford was a research scientist who created the concept of calorie restriction and longevity, and did a number of experiments in which organisms and various types of animals, he extended their lifespan, some of them rather dramatically. So Dr. Longo, under the tutelage of Roy Walford, developed his own research facility down in Southern California. In 2018, he presented the first international conference on fasting, calorie restriction, and longevity, in which I attended along with a colleague of mine. And there I met a number of world-renowned researchers who have studied calorie restriction and fasting and the effects that it has on the body. So in my previous podcasts, I've talked about various types of lab tests that can be used to evaluate the effect of fasting, or in this case, fasting mimicking diet, on your health. So there's a number of different labs, inflammatory markers that can be measured, such as fibrinogen and ferritin and C-reactive protein, fasting insulin. So these are all markers that you can look at before and after. So the benefit of this fasting mimicking diet that Dr. Longo created was originally he was trying to do some fasting techniques on cancer patients, because we know that cancer patients will actually respond very favorably to fasting. So during his research, what he found was that there was a lack of compliance, basically, to doing water fasting. And oncologists that were working with him at the time also were not real keen on fasting their patients. So Dr. Longo, in an effort to increase compliance with both physicians and also with patients, developed a fasting mimicking diet. And a fasting mimicking diet is a particular kit that he developed that makes things really easy, and patients basically are able to eat a small amount of food, but yet experience all the benefits of fasting. So, as we mentioned in previous podcasts, fasting creates this amazing phenomenon called autophagy. Autophagy is a process by which the body breaks down unwanted cells. So initially, the first phase of fasting, you break down carbohydrates in the form of glycogen. The next phase is autophagy, where you break down proteins. And these are proteins, intracellular proteins, that are basically getting old, and the body no longer needs their use. So the body breaks them down and uses them as fuel. So this process lasts for a day or so, and then what happens is the body goes into a phase of ketosis. Ketosis is where you break down bodily fats, and when that starts happening, that's when the body starts increasing the amount of ketones, and ketones are then used for energy source. So during this process, again, that's where the body starts to make stem cells. Stem cells are cells that can be used to create any tissue in the body. So if you have to create new cells for binding insulin, that's great. So if we take a look at this kit's called a Prolon Kit. This Prolon Kit is, created to make things extremely easy, in this particular sample, we have day 4. So there's 5 days involved in this fasting mimicking diet kit. And one of the things that is created during these fasting kits are these little meals. Basically, these meals are soups that you can basically make. Takes about 5 or 10 minutes to make each of the soups. And there's a specific amount of carbohydrate, fat, and protein. So that is the beauty and the effectiveness of the fasting mimicking diet, is that they're measured to be a very specific amount of fats, carbohydrates, and proteins to allow you to get into ketosis. So usually ketosis happens during about day 3. So that's why this kit was created for 5 days. In the first day, day number 1, basically there's 1,100 calories involved. So 1,100 calories is a pretty significant amount of calories that basically allows the patient to gradually get into their fast. On days 2 through 5, there are 700 calories a day. 700 calories, again, is the correct amount of calories to allow the patient to go through the autophagy phase and then to go into ketosis. So I usually will tell the patient that during their phase of getting converted from autophagy into ketosis, there is a transitional period that the patient may have some side effects, and that would be headaches or withdrawal symptoms from the normal foods that they're normally consuming. So the fasting mimicking diet kit usually allows the patient to go through this phase much more smoothly and more easily. So this means that it doesn't require supervision from a healthcare practitioner or from a physician. So I have done this kit about 6 times. I've done over 100 fasts in my lifetime, mostly juice and water fasting. So I know and I've experienced, the effectiveness of these fasts. I've also done broth fasting. So a couple of years ago, I went to the oldest fasting clinic in the world, the Buchinger Fasting Clinic in Germany. And in this clinic, they use a specific broth that they create from cooking up some vegetables. And this broth is a very limited amount of calories. Usually it's about 114 calories a day. So 114 calories is a pretty small amount and allows you to go into ketosis faster than doing a fasting mimicking diet. It's also, pleasurable because you get to do a broth rather than just water. So the question arises, well, how often should I fast? And really that depends on your health. And so if you have a particular medical condition, you might want to do fasting a little bit more frequently. On an average, the average healthy person, maybe 2 to 3 fasts a year. Again, it's designed for 5 days, so it's a short fast, and it allows you to go through the process of breaking down your carbohydrate stores, autophagy, and then finally into ketosis. So that is a very valuable phase, because during the transition into ketosis is when you start to generate your anti-inflammatory effects and also develop stem cells. Stem cells are cells specifically that the body uses to replace old and worn out cells that you don't need anymore. And if you're treating something like a cancer or something more advanced like autoimmune disease, you might want to do this fasting mimicking diet more frequently, like every month or every other month. So I do recommend, obviously, if you have some advanced cancer or some type of autoimmune condition, that you are supervised by a physician if you're going to undertake such a therapy. But this therapy is very simple, and it's easy, and it's extremely effective at doing what you need to do, which is create less inflammation in the body and generating more stem cells. And so, we know that this fasting mimicking diet, along with fasting, will indeed extend your lifespan, most likely. And the reason for that is that we know through many, many studies that calorie restriction is really great at decreasing various types of inflammatory markers in the body. So fasting mimicking diet is your easiest way to attain this goal. If you go online and you look at prolonlife.com, you'll see that there's a whole website with a number of different products. So don't get overwhelmed by all the products. What you want to select is just the basic Prolon Kit, and that is a 5-day fasting mimicking diet. And it has everything and all the instructions that you need to follow and easily get through this program. You can add some different features if you would like. I sometimes recommend using a constant glucose monitoring system, which diabetics can use, where you can actually check your blood sugar during this particular treatment regime. In addition, I recommend getting a ketonometer. A ketonometer is something that you can measure the number of ketones in your body. They also make ketone strips that you can urinate on, and that's another way to check to make sure that you're into ketosis. The benefit of this fasting mimicking diet is especially towards the end when you're transitioning out of the fast and you're going into your dietary plan that follows. It's a good idea to make sure that you have a particular plan when you're coming off the fasting mimicking diet. You don't want to go onto a seafood diet where you see it and you eat it. So the fasting mimicking diet is completely vegan and whole foods, plant-based. So if you're, a vegetarian or vegan, you won't have to worry about that. These ingredients were selected by Dr. Longo to be used in his product. So they have a little bit of an Italian slant. So you'll see that there's, olives. I particularly don't like olives, but these olives are actually really quite good. I usually rinse them a little bit when I eat them because I'm not a big salt fan. But this fasting mimicking diet is vegan safe, whole foods, and plant-based. So enjoy. There's actually inside the kit, there's a number of supplements in there that they recommend for you to take. So these supplements have electrolytes. So, basically you want to follow the instructions pretty much verbatim, what they talk about. There's also a solution of glycerol that helps stimulate you to get into the process of ketosis. So, and the amount that you take in is basically geared towards your body weight. So fasting can be really intimidating, but it doesn't have to be. If you want to know more about the fasting mimicking diet, check out the website below for a discount. If you want to support our channel to help make more informative videos, check out my website at marznutrition.net and my complete line of supplements, which includes state-of-the-art multivitamin supplement, Omnivite, state-of-the-art antioxidant formula, OxyQuench Ultra, Cardiomaglopex, a sustained-release magnesium product, and finally Dr. Hubbard's healing formula, which basically is for the gut. Thanks for joining us, and I'll see you next time.